A strong trunk is essential for functional movement. Trunk control forms the foundation for limb motion, and instability in the trunk makes normal movement impossible. Strengthening trunk muscles not only improves trunk stability but also indirectly benefits the neck, scapula, and hip muscles. This chapter explores various trunk movement patterns and their applications in rehabilitation. Trunk flexion and extension patterns consist of three main components: flexion or extension, lateral flexion, and rotation. These motions involve the entire upper or lower trunk, not just individual spinal segments. The diagonal patterns of movement, such as flexion to the left and extension to the right, engage specific muscle groups for effective rehabilitation. Different trunk movements activate specific muscle groups. For example, chopping to the left involves the left external oblique, rectus abdominis, and right internal oblique. Lifting to the right activates all neck and back extensors, left multifidi, and rotators. Lateral flexion to the right can have either an extension or flexion bias, engaging different sets of muscles. Trunk exercises can be performed in various positions: supine, side-lying, prone, or sitting. Resistance should be applied to the extremities to ensure trunk muscle activation. The timing of movement is crucial, with extremities initiating motion and the trunk completing it. Locking in the extremities at the end of their range allows the trunk to be exercised more effectively. The chopping pattern uses bilateral, asymmetrical upper extremity extension combined with neck flexion to exercise trunk flexion. The lead arm performs extension abduction internal rotation, while the following arm assists. This pattern is useful for facilitating functional motions like rolling forward or coming to a sitting position. During chopping, the therapist stands on the patient's left side, grips the patient's left hand, and applies traction to elongate the trunk muscles. The command is to push the arms down and lift the head, guiding the patient into trunk flexion with rotation and lateral flexion to the left. Resistance is applied mainly through the arms, with the arms acting as a handle for trunk movement. Chopping can also be performed in a sitting position to train trunk and hip flexor muscles. At the end of the pattern, only the trunk moves while the arms serve as a handle. Timing for emphasis involves locking the arms at their end range and using them to exercise trunk flexion. The lifting pattern uses bilateral, asymmetrical upper extremity flexion with neck extension to exercise trunk extension. The lead arm performs flexion abduction external rotation. This pattern is useful for facilitating motions like rolling backward or moving from a slumped to an erect sitting position. During lifting, the therapist grips the patient's left hand and applies traction to elongate the arm and trunk muscles. The command is to lift the arms and push the head back, guiding the patient into trunk extension with rotation and lateral flexion. Resistance is applied through the arms and head, with the arms and head acting as a handle for trunk movement. Lifting can be performed in prone or sitting positions. In prone, the exercise is done against gravity and is suitable for stronger patients. In sitting, the focus is on trunk elongation without causing lumbar hyperextension. At the end of the pattern, only the trunk moves while the arms and head serve as a handle. Bilateral, asymmetrical lower extremity patterns are used to exercise trunk muscles. The legs are held together and resisted as a unit. These patterns require at least one strong leg and can be performed with various knee motions, typically hip flexion with knee flexion or hip extension with knee extension. To perform bilateral lower extremity flexion with knee flexion for lower trunk flexion, position the patient near the edge of the table with legs together. The therapist grips the feet and thighs, applies traction and rotation, and commands the patient to bring their knees to the right shoulder. The legs act as a handle, and only the pelvis moves to exercise the trunk. For bilateral lower extremity extension with knee extension, position the patient near the left side of the table. The therapist grips the feet and thighs, applies traction, and commands the patient to kick down. The legs extend together, and the trunk elongates with rotation and side bending to the left. The goal is trunk elongation, not lumbar hyperextension. Trunk lateral flexion can be performed with either a flexion or extension bias. The therapist uses bilateral leg flexion or extension patterns with full hip rotation. Hip rotation controls the trunk side bend, and traction through the femurs locks in the trunk muscles. These patterns can be performed in both lengthened and shortened ranges. Upper and lower trunk patterns can be combined to suit the patient's needs. Examples include chopping to the left with bilateral leg flexion to the right, or lifting to the right with bilateral leg extension to the left. These combinations can involve counter rotation or be performed without it, and can be adapted for static or dynamic contractions.